Meow, I like cats. Yes, I eat air. Meow, I like cats. Thank you for your comment. I've literally been laughing at this comment for about 5 minutes now, or trying to do this scene, because I keep imagining someone with a very serious face saying, yes, I eat air. Welcome to another episode of responding to your comments. My goodness, we are getting so many comments on the page and I'm loving the interaction that we've got going on YouTube. We're going to be looking at fun questions, we're going to be looking at health questions, so what are we waiting for? Let's dive in. Abigail for Less. Can you do a video for a cough, please? Abigail, thank you for your comment. This is from the How to Get Rid of a Sore Throat video. Coughs. Yes, I can do a video on coughs. Coughs are probably one of the most common questions we get asked in community pharmacy. So when I'm working in community pharmacy, it probably is one of the most common questions I get asked, especially in the winter. But there's a few things I always ask patients to begin with. So the most important thing that I always ask every single patient is, firstly, how long have you had this cough? Have you had it for a week? Have you had it for 2 weeks? And if you've had it for 3 weeks or more, then I will always refer the patient to speak to their healthcare professional, whether it's their doctor, their advanced nurse practitioner, or their advanced pharmacist practitioner. Other questions I ask include, are you having any chest pain? Are you struggling to breathe? Are you losing weight for no reason? And also, are you on any medication or any treatments that are reducing your immune system? Or are you immunocompromised, which is what we say. So for example, you're having chemotherapy, or are you taking any medicines that reduce your immune system? So if any of these are a yes, I will again refer on to the patient's healthcare professional, because they will need to investigate what's going on. By the way, this wasn't a full list of questions I ask. I will leave more information for you in the description below as well. Now, in terms of what to do, it really depends what type of person you are. And this will make a bit more sense later on in this video, I promise. But generally speaking, if you have no red flags and there's nothing to worry about, and you're over 5 years old, I always recommend warm water mixed with honey. Because 1, it's inexpensive. 2, everyone has these kind of ingredients at home. And 3, which is the most important thing, the evidence has shown warm water and honey is just as effective at reducing a cough as the over-the-counter remedies that you can buy at pharmacy or anywhere. So how do you make this mixture? Well, it's very easy. You get 1 to 2 teaspoons of honey, mix it with warm water, let it cool until it's a sensible temperature, and drink it. Easy as that. You can do it a few times in the day, or as much as you need it, really. The reason I say it depends what type of person you are is that a lot of people, this isn't convenient for them. You know, if you're working, if you're busy, nobody can really carry a pot of honey with them and a kettle, or even at work, to keep mixing this solution and keep making it and drinking it. So there is this convenience factor that comes into play. So sometimes patients will say to me, Abraham, that's great, the honey and water mixture is great, I can do that on the weekend, but I work, I'm busy, I've got stuff to do, I don't have time to carry a pot of honey and get boiling water all the time and let it cool. Which is understandable, because a lot of people don't really have time for it, and it's that convenience factor that I mentioned. So they'll say, Abraham, just give me a cough mixture, please, just give me a cough mixture. What do you recommend? And I'll say, okay, that's fine, it's understandable. Now, in terms of cough mixtures, as long as you're fit and healthy and well, and you're over 12, there is some evidence supporting the use of guaifenesin, so look out for this ingredient in the cough mixture. The evidence has shown that it does work well as an expectorant. There's also dextromethorphan, which is useful to relieve a cough, as long as the cough isn't persistent. So in asthmatics, you have a persistent cough, so it won't be useful for that. And also, as long as you're not producing excessive phlegm. But I would always recommend everyone to speak to their pharmacist so they can check your symptoms, rule out any red flags, and recommend you a product that's suitable for you and it's safe for you to take as well. So that's the most important thing that I would recommend everyone to do. But please remember that these remedies will help to reduce the symptoms of an acute cough. But if there is an underlying infection, it's not going to help with that. And also, if your cough has been going on for 3 weeks or longer, it's not going to help with that either, most likely. So you will need to definitely speak to your doctor or any healthcare professional who looks after you. Thank you for your question. I really hope my tips help everyone, and you're awesome. Back to the comment, yes, I eat air, from Meow, I like cats. Thank you for your comment. This is from the How to Stop Bloating video, and in the video I do discuss about eating air and it making bloating worse. But I did say this isn't physically doing this, because nobody does that. Nobody eats air like that. But when we're eating food, if you're eating it fast, if you're eating it like slumped and not straight back, if you're chewing with your mouth open, if you chew gum with your mouth open, all of these can increase the amount of air that we kind of swallow, and it can all make bloating worse. But it's just the way that you said it. Yes, I eat air. I just imagine this very serious face saying it, but I really hope my tips help you. Thank you for commenting. Jessica Furtado, oh my god, my nasal spray always goes down my throat because the instructions say squirt and sniff. They usually do, that's correct. I tried what you said, squirt at an angle and small sniffs, then once it stops dripping, you can breathe normal. I tried and I can't taste anything in my throat. This is amazing. I almost stopped the sprays and was gonna ask for antihistamine pills instead. Jessica, thank you for your comment. This is one of the main reasons why I love YouTube so much, because it makes all of this useful information accessible for everyone around the world. So I'm glad that it helped you. One of the main reasons people do stop using a nasal spray is because of that horrible aftertaste that it can leave if you're not using it right. So thank you for your comment. It really put a smile on my face, and I hope you continue enjoying all my future videos. Alpha Ghost 316, my voice sounds deeper than Thor and Thanos combined. Alpha Ghost, thank you for your comment. This is from the how to fix a sore throat video. And yeah, that must be pretty deep because them two definitely have very deep voices. And I hope with a click of this finger, or is it this finger? I can't remember. Your sore throat has gone away. Thank you for commenting. Looks like we've run out of time again in this week's video. If I didn't get back to your comment, I'm really sorry. Please leave another comment and I'll try my best to get back to you in a future episode. Always remember you're awesome and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.